Jack, welcome, and if you could just tell us a little bit about your practice and how many patients, IBS patients you see on a weekly basis or daily or monthly basis.
Yeah,
We'd love that.
absolutely. Well, first of all, thank you, Zach, for inviting me to talk to you and share my experience clinically with IBS patients and my approach to treating IBS patients. So, as you stated just now, there's a lot of people that suffer with this disease state. You're talking about 10 to about 15% of the general population that actually has IBS. That translates to about 45 million Americans, but only 5 to 7% actually seek care, right? Now, of this 5 to 7% that actually seek care, that actually makes up the number one reason why we as GI doctors see patients, right? And that those numbers are around 30 to 40%, maybe higher in people that have really specialized in it. But in general, I would say 30% of all the visits we see are because of this one condition of IBS. And I feel like in my, you know, clinic, I may be attracting some of these individuals. So my numbers are probably closer to 50 to 60%. So I see bloating, abdominal pain, discomfort, altered bowel habits, all day long. Yeah.
And so that maybe leads me to the next question. Can you explain just really quickly, in layman's term, what IBS is and kind of how it affects people's lives?
Absolutely. So it's a very common chronic condition that is a disorder of the gut-brain interaction, right? And I'm glad that we're defining it in that manner now. Before, it was labeled as a functional disorder, almost to imply like it's in your head, right? And this has to do with anxiety and whatnot. And so I'm glad now we're looking at it from more of a gut-brain interaction. Now, technically, there is a criteria that defines IBS, and that's the Rome 4 criteria, which states that you must have abdominal pain for a certain duration of time, and that has to be accompanied with altered bowel habits, whether that's constipation or diarrhea, right? So that's the technical definition, but I like where the society is headed and why and how we're labeling this as a gut-brain interaction disorder. And the reason why this, is important because when we're looking at what's happening here, it's really that the signals between the gut and brain, those nerve signals are hypersensitive, right? And that then leads to either those nerve signals telling the muscles of your GI tract to work faster or work slower, right? So that results in diarrhea or constipation. Sometimes the nerves are really hypersensitive, and that can, manifest as abdominal pain or discomfort. So that's kind of how IBS is now being viewed. But I think that as we continue to have this conversation, I see lots of advancements in this field, and I have a vision of, hopefully where we evolve to in terms of IBS, particularly its management.